Now we have ramus. Ramus is quadrilateral in shape and has two surfaces, four borders, and two processes. Two surfaces are lateral and medial, four borders are upper, lower, anterior, and posterior. Two processes, coronoid and condyloid. Lateral surface is flat and bears a number of oblique ridge. Medial surface present the following feature. Mandibular foramen lies little above the center of ramus at the level of occlusal surface of the teeth. It leads into mandibular canal, which descends into the body of mandible and opens at the mental foramen. Second is lingula. Anterior margin of mandibular foramen is marked by a sharp tongue-shaped projection, which is also called as lingula. Lingula is directed towards the head or condyloid process of mandible. Mylohyoid groove begins just below the mandibular foramen and runs downward and forward to be gradually lost over the submandibular fossa. Upper border of ramus is thin and is curved downward to form a mandibular notch. Lower border is backward continuation of the base of mandible. Posteriorly, it ends by coming into continuation with the posterior border of the angle of mandible. Anterior border is thin while the posterior border is thick. Coronoid process. It is a flattened triangular upward projection from the anterior superior part of ramus. Its anterior border is continuous with the anterior border of ramus. The posterior boundary bounds the mandibular notch. Last but not the least, it is the condyloid process. It is a strong upward projection from the posterior surface part of the ramus. Its upper end is expanded from the side to side to form the head. Head is covered with fibrocartilage and articulates with the temporal bone to form a very important joint which is known as the temporomandibular joint or in abbreviation called as TMJ. The constriction below the head is neck. The anterior surface present is depression called as the pterygoid fovea.